So, welcome to the Yoga Therapy Institute's Progressive Conversations in Yoga Therapy. And I have the lovely Yasmin Bedi. The last session that we did, Yasmin interviewed me about my path in yoga therapy. And I shared a little bit of information about how I started in yoga. And this week, we're going to ask Yasmin about how she ended up becoming a IAYT-Certified yoga therapist. She is also a medical professional. So we're going to hear the story about her path when you started right from the beginning. Well, I guess I don't know whether you decided to become a doctor from the age of 3 or that came later. And yeah, to hear the story, looking for some inspiration, and then we'll just dive deep into that collaboration between the medical system and yoga therapy, which you actually represent in a way. So, welcome, Yasmin.
Oh, thank you, Mons.
Yeah.
Glad to be here.
So, Yasmin, let's begin from the beginning, as I always say. So, can we hear a little bit about, because actually I want to remind everybody, first of all, that Yasmin is going to be the leading teacher in Yoga Therapy for Healthy Aging, which is a short course I'm going to be offering in May, 6th and 7th and 8th of May, coming up soon. And this is why also this conversation is very relevant, because it's that, as I said, that combination between what is a medical professional? What is a medical professional doing? Talking about aging and yoga therapy, and how can yoga and yoga therapy help? But let's begin first of all on how you started. I would like to hear a little bit the story as you were a doctor. When and how did you decide to become a doctor, and where you're from and your origins and so on?
Um, yeah, good question. Um, so um I am mixed heritage. So my mum is British, white background in the Midlands, and my father came over from India in the 70s um to train as an air traffic controller. And however, everyone in his family were medical or dentistry people. My grandfather owned a hospital, and my father was always expected to do medicine. So it was almost, I don't think anyone ever said to me, do medicine, but it was like there, always in the ether. And from a very early age, I just picked up on that. Um, my mum was just happy for me to do anything that meant I was not on the streets getting into trouble. Um, so, however, so I was always quite interested in learning, which was helpful. I was obsessed with reading as a child. I used up the whole of the school library by about the age of 9, and they sent a letter saying that I needed to stop reading because they'd run out of books. Um, but in my teenage years, I did want to become a journalist or a UN aid worker. Yeah, I
I
was.
can't believe it, Yasmin. May I say to you that that was actually originally my dream as well. One of them was to be a war, a conflict journalist. That was
Yes,
one of
that
them.
was the sort of journalist I wanted to be. Yeah. Because I remember, so the news was really important in my house, and I just remember seeing all these images from war zones, and I thought, "Oh, I
Yeah.
want to tell people stories. I want to hear
Mhm.
more about them, but everything was so limited on the news. Um, but then I ended up studying sciences because that was quite good. Um, but it wasn't plain sailing. I didn't go straight into medicine from school. I I had some episodes of depression that meant that I didn't do so well in exams as expected. So then I had to take some gap years, which was amazing. I traveled and I worked. Um, but it just meant that everything was a little bit more circuitous. But actually, in retrospect, that that brings experience that other people don't have. Um, I suppose the most important year. So my medical degree, my undergraduate degree was in London, but my medical degree was in a sort of Caribbean and American medical school. So I was in the Cayman Islands for a couple of years. Yeah. But then there was a hurricane and I had to flee. We had to flee. I had to leave the island on the last flight to America. And then I was in America for about a year. Then I did some clinical work in London and went to finish my degree in New York. But and I wanted to, and at that point I wanted to do residency in America and have my life there. But I'm an only child. My parents are separated, and my mum was beginning to get unwell. And I was in my sort of mid to late 20s.
Mm.
And I just, my mum sent me frozen red Leicester cheese in the post to New York so that when it arrived, it would be fresh and she'd wrap it in fluffy socks. And I was like, oh, like they're my two loves, fluffy socks and cheese. I couldn't leave her. So I came back to the UK, and because it was an overseas degree, I had to do the um, the General Medical Council make you do some exams, which were really straightforward, but there was a long waiting list. So in that time, I worked as a home carer, providing personal care in elderly people's homes, and I did that for 9 months. And I think it was backbreaking. The care, like so being a home carer, so you're providing personal care, and they're usually elderly people, and it was in these little villages, and they were just such amazing people. Sometimes all they wanted was a cup of tea and to tell you a story, and then it's like listening to your grandma, and they would talk about the war or their husbands, and and a few times in a 9 months, I'd say three of my clients I found on the floor with a broken hip. There were a few that had had a stroke, so someone else would come and we'd do double up care. And that was eye-opening because I don't think I'd ever seen anyone. I mean, I'd done rotations in hospitals and I'd seen people that had had a stroke, but I'd never seen how you care for them and how you transfer them with a hoist and seeing how debilitating it can be, but
Yes, and
then
scary, and scary,
and scary. And
very scary. Yeah.
there was one person that lived by themselves and just never really flourished, and then there was someone else whose wife would just you'd get him into the chair, you dress him, and then the wife would do all this stuff, and he had such good quality in the family, and it was like, black and white. It was is the impact of family support and love and care was just so obvious there. Like
I
we were
could witness that.
providing,
Yeah,
yeah.
witness that. And would you say that this experience, do you say for 9 months, right?
Yeah.
That was this, was it maybe you said you came back to the UK because your mum was not feeling
Hmm.
well. And was that experience together with these 9 months you spent seeing, participating, being an integral part of these older people's care that started to maybe planted a seed in you or kind of like started to create some kind of, yeah, something started to
Absolutely.
ferment there to
Yes.
grow.
Yes, because when I was a medical student doing my clinicals, um, the geriatric ward was a ward that wasn't it was never a place of interest. Go to the gastro ward with all these, they had these procedures and all these clinical signs, or you go to respiratory and you can see drains. But the elderly ward was never a place that was like go and learn and you know
Mm.
because um because in medical education it's changed since when I trained, but it was very much about your hands-on doing your procedures, high octane, get all your knowledge. But it was felt like no one could learn anything from the doctors and the patients on an elderly care ward. So
Wow.
this was my first time of actually, it's the simple things that make a difference. And so this totally planted the seed. So when I got into training, and then once I was in training, it was 9 years straight through to become a consultant. One of my first jobs was in elderly care. And within a week, I was like, this is absolutely what I want to do. Um, so so I spoke to the consultants and the other people and said, how do I do this? And um, yeah, and loved
Yes,
it.
I can understand. So you said elderly care. I'm going to just make a little kind of like question here, since I know how involved in this kind of work you are. Um, there's a lot of kind of like um, language politics about what is right to say, what is not right to say, the correct way to speak about the elderly. And there's different terms that people use. Like, it's quite interesting because depending whether you're in the US and the UK, or actually I speak other European languages like Spanish and Italian, and then it's used in a completely different way. But older adults, um, elderly is now supposed not to be correct,
Mm,
right? But
yeah.
yeah, I
So
mean, yeah. So what is it that, in your opinion, what is the origin of this? What's the reason for this? Are we going too far with the language, with the corrections? It's different
mm,
everywhere. What would you say? You said elderly care. To me, it sounds perfectly, yeah, perfectly fine. Um, but sometimes I see, tools for taking care of the elderly. Oh, no, 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 you cannot call them elderly
yeah,
anymore.
yeah.
So, yeah, that's quite interesting. But I guess if you're 90, you are part of the elderly population.
Well, I don't. Yeah, well, this is the thing. I think if you went to 85 to 90s to 100s and said you are elderly, they would say, yes, I am. Um, so back in those days, we called geriatric medicine elderly care. So it was the elderly care department, and um, there was no doubt about that. But I'd say 10 to 15 years ago, maybe 10, then when there were more debates, as the interest in that population grew, there was more debate about the terms we use, how we refer to people. So most departments now are called older persons medicine, medicine for older persons,
Yeah.
um, or it's shortened to OPM or whatever. But it's
Yes.
such a mouthful.
Yeah, older persons. Yeah, 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 yeah. Exactly.
Mm.
I mean, generally humans, when it comes to communication, we're lazy and we want something that is quick and easy
Yeah,
to
yeah.
write. One thing is for sure, we don't say old people anymore, or
No.
those old people, right? Exactly. So that's not right to say. And also the age, I guess that is kind of, it's a little bit tricky, because if you are 60 plus, I mean, wow, I mean, I'm over 50, I'm closer to 60, I'm 58, and yet I'm still get shocked when they say, for older adults 50
Mm.
plus. And I go,
Yeah. I mean, when I
so yeah,
see some of the adverts on the telly, I don't watch TV very much, but when I visit relatives, there are adverts for things like cremation and life
yes.
insurance. And the the elderly life insurance or the older persons is 50 plus.
Mm-mm.
The people in the adverts are never older than about 65. And I'm like, this just doesn't reflect real life.
No, it doesn't. It doesn't.
Because over the last 100 years, with the improvement in just basic care, infrastructure, sanitation, general health, what is considered old is now shifted much further along than it used to be.
Yes, absolutely. I have an 85-year-old mother, who, well, she's considering and saying maybe I should go to some home care. And then she said, but I don't want to sit with those old people. She said. And I looked at her, 85, and I go, but mom. So it's quite interesting how you see yourself in one way and you see others in another. And so I just wanted to clarify a little bit the term from your perspective, what it is, and would you consider older person's medicine from what age? Is it 50 plus, 60 plus? From what age? Older person's medicine.
Um, so in my hospital, it's 85 and above,
Okay.
but we recognize we should probably have younger people, but the logistics, the space and the manpower isn't there. But I'd say probably it's 75 and above within the NHS, sometimes 65, but generally 75 and above would be considered. But
Okay.
it's such a wide spectrum. You get independent 95-year-olds, and then you have 55-year-olds who have the same needs as a very frail
Yeah.
older person.
Yes, absolutely. So tell us a little bit more, going back to, yeah, okay. So you started to work and you said, okay, this is the area that I want to work in,
Mm.
right? And that's when you started to work. Do you specialize in geriatrics, or was there some kind of specialization that you do?
Um, so for the first 2 years, so I locumed for a bit, but that was just in surgery. But then my training, you rotate different areas, so psychiatry, surgery, medicine. I think they were the main three I did. GP, ITU. So you get a breadth and experience of just working in different spaces and interacting with different kinds of nurses with different aims on each ward. Then you interview to specialize in your sort of parent specialty. So mine was medicine. It's changed now, but I did 2 years of general medicine, rotating through cardiology, renal, infectious diseases, geriatrics, a few other bits and pieces. And then I applied for a 5 year specialty, geriatrics plus general medicine. So my day job was geriatric medicine, but then I would do on calls where I cover the whole of all of the medical wards. And then if a surgeon has a medical question, they'd ring me and I might go and see their patient. So, and that's 5 years.
Um,
Um, got lots of experience. I got
yeah,
very
you need to do
doing
it.
nights. Hmm.
I think in that field, you only learn from experience. I mean, not only, but I'm saying experience is essential because that's
Essential.
when you really see the reality. And it
Yeah.
was quite interesting because I was reading a book, and that it was especially it was about this subject, which actually I will add to the credits here in the YouTube channel, which it said that how a geriatrician thinks in a very different way. So he was talking about how they went to this woman's house and she was very old and she was in her 70s, maybe in her 80s. I can't remember. She'd gone from being a very independent woman to, due to an accident, to becoming almost completely dependent. And then, of course, you as a witness, you think, oh my God, this woman, heart disease, you think all the different aspects, nervous system, all the things that are going wrong, when actually the geriatrician, the first thing that he did was to look at her feet.
Mm.
And he looked at the health of her feet, got the feet out and said, okay, sit down, let's take a look. Are the feet well taken care of? Has she injured herself in the feet? And they had a special, and he would actually refer her to a special podiatrician to take care of the feet. It was that different thinking from a geriatrician because for them, they know how important the feet are. They're a mirror of what's going on with that person, and also for balance and also for neuropathy due to high glucose levels in the blood, etc., etc. So it
Yeah.
was quite interesting. And the eyesight as well for them is important to say, okay, can you see the objects around you in your room? So yeah, how, of course, if there's a heart issue, there will be, right, okay,
Yeah.
referred
Get
maybe for this.
advice and referral. Yeah.
Exactly. But I found it fascinating, and having, of course, I grew up in a family with a lot of elderly, because you can call them like that because they were like 80 plus and some of them died to over 100. Um, that yes, I recognized it. I thought, okay, yes, I know what it's like. They can't even right? The
Yeah.
soup, the yogurt,
Oh.
that, you know, that, right? Okay. So it's quite interesting how differently a geriatrician thinks. And we don't talk about geriatricians. I mean, when enough. It's
Mhm.
coming up now with all these
Yeah.
obsessions about
Yeah.
healthy aging and about, right. So you're working there. And so why yoga? What's going on with yoga? And then my question, of course, because a lot of people don't realize, but is it because you have part Indian origin or has nothing to do with it? Or why
Mm.
yoga?
So, yeah, so my father is Sikh. Um, so yoga was not part of what he did. But when he went to pray, he would have to, he'd sit cross-legged, listening, meditation. Sometimes there would be music. And so there are certain elements that run through sort of the philosophy of yoga that are also part of the Sikh tradition. Um, and very much for him, it's the contemplation, the meditation. Um, and so from a young age, I was sort of exposed to going to the Gurdwara, um, in service, so preparing food in the kitchen. Um, and then having to keep still. And part of that was about getting myself ready to sit down so that I'm not wriggling around during the service. Um, and and then yeah, the contemplation. My dad would expect, there was an expectation that I. So my mum was a Christian, and sometimes if we very rarely went to church, but if we did, there might be kids running around in.
Always.
Yes, but that wasn't that. If you were a child and you were going to run around, you'd be in the kitchen. But my dad wanted me there to hear the service, so there was an expectation there would be stillness there. And so I was always very interested by that element. And then in terms of the yoga thing, at a very young age, I started to do a lot of exercise, but I really liked dancing. I did ballet, but I actually really loved aerobics. And so the person I did aerobics with, there was no YouTube, but I had books. She incorporated a lot of yoga at the end as part of your relaxation. So I did a lot of, at the age of 11, I was doing cobra and cat cows. And it was a very yogic take on the purpose of those postures, which I didn't realize at the time. And so as I got older, they became a part of my daily life. And then one day my mum just said, you need to go and attend a proper yoga class because there are more elements to this that are missing from what you're doing.
Your mother said that.
Yeah, yeah. So
Ah,
she was like, you need to de-stress, go to a yoga class. So, so sort of the limbs as they were had been separated through like a cultural thing, but the yoga class was like bringing it together. And I I spent 2 or 3 years in the Satyananda Hatha Yoga lineage, and that is a very organized. You start at the beginning, and you have to learn this before you can progress. And it's very serious. But what I loved, because I also signed up for Iyengar classes at the same time. I wanted to try both, but I had a car accident. And the lady at the Iyengar class said, if you can't make the classes because your car is broken, you're not getting your money back. But the chap at the Satyananda school said, I'll take your money, but I will defer by a term, come back when you're able to get here.
wow. So he was clever.
He was clever. He knew what he was doing. But it meant, but I loved that style. I don't think Iyengar would have been for me anyway.
No, as a matter of fact, but Satyananda Yoga was part of my training in yoga therapy. That my training
Mm.
in yoga therapy, like I said, the other week, was very medical. But what I liked about it is that it had many influences from various yoga traditions and backgrounds and schools. And one of them was Satyananda. And of course, like almost in every single yoga school, there has been some history of abuse because Satyananda School, part of the Bihar School of Yoga, is very uniformed. Yeah, there has been reports of abuse as well within that environment. Um, and but I remember teachers coming from the Satyananda School of Yoga in their uniform, orange, if I remember well. It was, yeah, the orange outfit, and then they showed us pictures. I remember thinking, this is not for me because everybody was dressed in orange, and I thought, no way. The white one, so it was some in white, which were the beginners, and then in orange, I was like, okay, no, well, orange is not my color, so I'm not doing this. So I'm only joking. No, but I thought, no, this is too regimented. But I like this style.
Mm.
I liked it. And am I right to say, Yasmin, that in the Satyananda teaching, when you're a Satyananda teacher, you do not demonstrate the practices, but you have somebody else demonstrating them for you.
So it was really interesting. So the head teacher, he never demonstrated anything, but he talked us through.
Mm.
And there was usually be a more advanced person who was still, maybe they were highlighted as the person to demonstrate, but they were always to his left side.
Yes, correct.
Um, so, and we'd be in a circle, a large circle in this hall. So there'd always be someone to look at, but everything was cued.
Yes.
So,
And it's very good learning. It's very good
yeah.
learning. And remember that one of the reasons why they taught us as well was to learn how to deliver a class without demonstrating so that you can actually speak a class. Actually, it's come very useful for teaching on Zoom because then that way I can teach on Zoom and I can have a whole group of people and students doing a series of practices. I don't have to do them. I know how to cue them, and that came from Satyananda during our yoga therapy training. So it's very strict, but I can understand why you would like it. It's very physical, right? It's quite
Mm.
structured.
It was,
Yeah.
yeah, it was physical, it was structured, but we always did a meditation, we always did a yoga nidra, and we do
Yes.
different meditations. So the one with the candle, Tricker, I can never say
Yes.
it properly. That was his wife. She also did classes. Interestingly, his wife would always demonstrate, but that was one of my favorite sort of concentration exercises. And it was quite a long class. It was 90 minutes.
Yeah, correct.
But a good
So that
half
means
an hour was we did the whole 8 limbs, and it was beautiful to have the meditation, the yoga nidra, then there's time to ask questions at the end. And it felt very spacious.
yes. Can I ask you a question? So you mentioned earlier maybe some periods of depression.
Mm.
Was this part of your, uh, did it help you to feel better? What was that connected with that it kind of like, or not? It was your mother said to you, you need to do yoga because you're anxious and
Mm.
whatever is going on. Not surprising. Yes, of course, people underestimate what it's like to be a student of any kind of studies and life and everything else. Um, how would you connect that the going to those classes with your mental health and how you felt and your progression and how
It's it's really there's no way you can't say it definitely made things better, but very quickly it became something I couldn't miss. And if I missed, I would notice the effects. I started to do my own little mini practice at home. Um, and then I just started to, and they talked about philosophy and they planted seeds and they taught the niyamas and yamas, but there was never any and they'd give us handouts and things to read. There was never any expectation we would go off and do stuff on our own time, but it planted a seed that meant that I would go to the bookshop for hours. I was obsessed with books anyway. I'd be reading philosophy. It just opened a whole pathway that I didn't even know existed. And I think the fact that it quickly became something that I noticed if it didn't happen means that there definitely was a positive effect. And also that I felt part of a community. you get there for the class, you have the chat at the beginning, you're always your mat's always next to the same people, so you get to know people.
Mm,
It wasn't a super deep community where everyone went for coffee, but you felt you were part of something. And
nice.
that was really,
And this was at the same time as you were working where?
so I was in Sheffield, and I was in the part of my training where I'm working through the different medical
Okay.
specialties.
Yes, just
And
to
I'd
put it.
had a horrible breakup as well. So everything just came together. But yeah, I sometimes, they still run, and I still sometimes look on their website. I want to see what events, because I always want to go back and do something with them because they were just such lovely people.
That I understand. I understand. So, yeah, and see, I had a horrible breakup. I have to say that I've seen it so often, going from a breakup to discovering yoga. It's really super interesting. Definitely, that it comes together somehow and it helps through recovery. But so and then at some point, I think where did we go from Satyananda? Because I know that you have become a yoga teacher, you have become a
Mm.
yoga therapist, you did your yoga nidra training with Umadin Smotuli, which now hearing about your background with Satyananda, it doesn't surprise me. Now it kind of all makes sense
Mm.
as well, because yeah, of course, because then you were familiar with yoga nidra. So
Yeah. And so eventually I left Sheffield to come back down to the south. I grew up in Hampshire, between Hampshire and Kent. So I wanted to come back to the south coast because it's warm. Um, so then when I came back, there were, I mean, there's loads of yoga teachers now, but there were very few. There was no Satyananda Hatha yoga teachers within a 15-mile radius. I'd have to drive for ages, and my hours were terrible. I couldn't do that. So I ended up finding a local teacher. So for a few years, I drifted. I'd go to the odd class because I couldn't commit because my rota was so awful and I was so tired. But I was doing stuff online and doing stuff from my previous class. Um, and then eventually, my next teacher was in Vinyasa, and she was my teacher for 3 years. And there was quite a difference between there's there was no philosophy apart from maybe a little reading at the end, a poem. There was no yoga nidra, and it became very competitive because I mean, I don't think I do now. I used to have a very flexible spine, so I could do really deep twists, and I had very good balance. So then it would be every week. I could feel it. It would be a competition. She'd come and adjust me. How much can you twist? Or how can you hold the balance? How long can you hold the balance? And then people would be watching like, oh, wow. And I lost, I lost the what yoga really was. It became that physical practice.
yes, it's you lose these subtle aspects of yoga. It's not
Mm.
only the physical and actually that level of competitiveness, of course, and demonstrating. In some cases, could be called showing off, even,
Yeah,
with the teacher. The
yeah,
teacher facilitates. I recently read something also that said, well, um, making yoga therapy less competitive is completely dependent on the teacher. So it's the atmosphere that the teacher creates.
yeah, yeah. And our teacher would go to all these workshops, and and I remember she came back from a workshop and she said, well, everyone was doing um they were doing planks to headstands to planks to the drop throughs to the L sit. And she was, by this point, she was in her 50s or 60s. And she's like, I had to leave after one day because I cannot do more than 50 headstands to planks and all the rest of it.
But
And
it's
it was
insane.
just,
Yes, it's just like why? Yeah,
yeah.
why would you want to do that? So you said you lost your kind of like the subtle aspects of yoga, perhaps became very physical, be competitive.
Mm.
And then where did you go from there?
Well, um, So in that time was sort of the time that I lost my faith in medicine.
Oh.
Yeah, so I was on a night, so I'd almost finished. I was probably a year out from being a consultant, and I was on a night shift, and we were doctors down, and I hadn't had a break, and it got to about, and people were sick. There was sick people everywhere, and I'm just running around. And then I took myself for a wee. My first wee of the night started at 8. It was now 3 in the morning or something. And then like in the movies, this happens in the movies, but you go to the wash basin, you wash your hands, and then you look in the mirror, and I like wetted my face, and I was just like, this cannot be.
The way.
I'm not making any difference to anyone. I'm literally just keeping people going, and I'm not providing any good, I'm not bringing any quality. I'm not no comfort. I was like, there has to be more. Like, I don't think I can do this anymore. So then yeah, and it was really interesting because then I came out of the bathroom, I sat on the floor outside the toilet just with my head in my hands, like, then I fell asleep. And I got woken up a few hours later by a cleaner. She was cleaning around me. She didn't want to disturb me. But I had my bleep, but it hadn't gone off because the battery had died. So then there was all this chaos downstairs that I'd missed. But anyway, it was fine. No one suffered. It was just still the chaos. But I left that shift thinking I'm going to leave medicine. I can't do
Mm.
this anymore. So then I started, so with my vinyasa teacher, because I'd known of how much benefit I'd received when I first started those yoga classes, I knew that there was something there
Mm.
that that was waiting for me if I don't know, um, looked for it. So then I started looking for more teachers, doing more reading, and did some workshops and started to rediscover the joy, the
Yes.
the deep aspects. Um, she stayed as my teacher for a few more years, or maybe another year, but then I left because there was a lady, one of the students had a connective tissue disorder. She was hyperflexible.
Mm.
And we were sat doing a yin pose, and she put sandbags on her already over flexible cross-legged position. And I was like, no, this isn't safe anymore. This is, I don't want to.
It's interesting how you got all these epiphanies in a way, kind of like these realizations in the medical system, then in the yoga system, to say, okay, this is not safe. First of all, I want to bring up something which is, well, we do underestimate the hard work of medics and the medical, what they're doing in the hospitals and in the wards.
Mm.
Um, the general public, we underestimate it. And really, we don't realize when you said about falling asleep on the floor, yeah, it's exhausting, yeah, physically and mentally. So there's a recognition to that. And you realize that you thought, okay, well, this is not the way. You were just keeping people alive, basically, or barely alive, if you want to
Yeah.
call it.
Yeah, yeah,
It was, oh my
yeah.
God, this is like, yeah, filling up this bottomless, right, bucket. And then in yoga, it's quite interesting that you mentioned that because we have spoken about it before about yin yoga, which we will talk about that one
Mm.
day also in some of our conversations regarding this this concept of stretching the joints, and when you do that with somebody, especially who has a hypermobility health issue, and then putting sandbags. So you felt that, okay, this is not right, and then you decided to stop, right?
Yeah. Yes.
Okay. And then where did you go? Well,
Um,
had you already qualified as a yoga teacher yet?
no. So when I finally dragged myself through the last year of being of my medical training and I qualified as a consultant, everyone told me life would get better. You've done it. It's going to be amazing. So I took 2 months out after that and I did my first yoga teacher training in India, in Rishikesh. I thought I'll go to the, the birthplace or the home of yoga. Um, but I went with a sprained ankle, a freshly sprained ankle, just 6 days, with a splint,
Oh my
and
God.
then spent a month I ruined my wrists, my other ankle, because I didn't want to stop. They didn't want me to slow down. So,
You pushed yourself through it.
yeah.
What kind of yoga teacher training was it? Do you remember?
So it was it was very general. It was just a
Yeah.
mixed it was mainly hatha and vinyasa,
Yeah.
and the philosophy was just it was very general philosophy by one of the local teachers. Um and but the first week was spent on building up your core strength. So it was all planks
Wow.
and jumping around, which really wasn't very good. And probably if I'd known that that was going to be the starting point, I needed to be physically fitter to have made it through that and
Yeah.
without an injury to come out the other end
Yes.
not not damaged. Um, and I still have wrist problems now. They never got completely back to normal.
Yeah, I know, and I know that we laugh at it, but yeah, recently, uh, not a very kind of holy example, but my hairdresser. She was telling me, I asked her, I hadn't seen her for a long time, and I said, well, are you still doing yoga? And she said, you know what? She said, I went to a yoga teacher training. I thought that I would also, she also went to a retreat with the intention of becoming a yoga teacher to train as yoga teacher. And then she said, I have a problem with my knee. And she said, at some point, sitting in easy pose, she said to me, why do they call it easy pose? It's not easy. She said her knee was hurting so much, and she was never given permission to extend the legs, that she said, I felt like throwing up every day at the end of each session. Like she said, like throwing up. So she said, my knee is now permanently damaged, and I'm doing Pilates. This is what she said.
Yeah.
This is what
Yeah.
she said. And she said, I'm thriving in Pilates. No, Pilates is, it also has its dangers.
Got it.
But right, is this idea of going somewhere where you go to become a yoga teacher or to train or a retreat, and then you have to do this practice. You have to do these practices, whether you get hurt or not. And sometimes, like you said, these injuries were permanent, but this didn't put you off yoga, obviously. You still continued.
Yeah, I still continued. I still loved it. I loved there were some amazing moments in the training that I really treasure. Um, and then I stayed another month in India, and then I started my new consultant job, which um, well, I wasn't teaching yoga when I came back because I thought I can't be a new yoga teacher and a new consultant. So that was yeah, so that would have been that's 2020. So I started teaching yoga in 2021. No, it wasn't. It was 2018. I'm lying. It was in 2018 that I started my new consultant job, and very quickly I just knew I didn't want to be there. Um, and at that time, I was I didn't have a fixed yoga teacher. Again, I was just doing odd workshops, going to odd classes in different cities and towns, and yeah, didn't want to start teaching as a yoga teacher yet. So just sort of fumbled around, reading lots of philosophy books. I did start to do a little bit more exploration of Buddhism, the Vajrayana Buddhism around this time as well, because in my earlier years I'd been in Sri Lanka and had been exposed to that as well. So, um, but I guess the next big thing would be sort of 2020. So that's when I started to do teach yoga for the first time.
Well, that's a tricky year to start teaching yoga, right? Because we were like, well, yeah, then came the,
Yeah.
the
So I
isolation.
so I'd been doing teaching from 2018 to 2020, but just with neighbours, so nothing formal, very
Mm,
informal little sessions in my house or in my neighbour's house. In
mm,
2020, I rented out our village hall and we had about 10 or 15 people at maximum, but usually about 10.
yeah.
Um, and so we'd have a really good run for a few months, and then there'd be a lockdown, and then we do some more, and then we do it outside. So I did that for a few years, and I loved that. That was with older people. The average age of my village is quite old, although we've got lots of young
Oh,
people now. Um, and that was mainly sort of Hatha style. Um,
yes.
although when I'd been doing stuff at my house, I had been doing yin, because I did a second teach training in 2021 that was yin focused.
Mm.
But in the lead up to that, I'd just been experimenting with people.
Yes, I think the majority is so refreshing in a way to hear this because I get a lot of students who apply for our courses, and when I have a little talk with them or through the training, and they say, "Well, I'm not a purist, and I've done things here and there, and then I've also introduced my own knowledge from sports that I used to do or from this that I used to do." Right, and everybody is again, it brings us to that idea of, but what is yoga really? Yes, there's no such thing as this pure yoga because then you have a Iyengar and right, and you have all the different.
Yeah.
Yeah, they're the ones perhaps that are a little bit more kind of yeah. There's certain schools that yeah that they bring in that discipline without that discipline without following very serious yoga protocols. Then you're not part of that community. You cannot do that.
Yes.
Um, but there's a big difference between Iyengar and Hatha Yoga and pure Kundalini or pure Satyananda as well, also very structured.
Yeah.
So yeah, so you've been teaching in during COVID, on and off, lockdown, yeah, then
So
you get yin yoga training and uh, and then I know that at some point you decided to become a yoga therapist
yeah.
or you started to investigate yoga therapy.
Um, yeah, so after I had the 2018 training when I was doing stuff at my house and at my neighbours sort of in and around the village, I I was really aware. It was really interesting actually. I started to develop this sort of I felt I couldn't call myself a teacher because I didn't have a class because I was doing stuff in community. Um, and then you go onto the Yoga Alliance website. I don't like the Yoga Alliance website, but it was like, oh, I don't feel I can. So I never registered. I didn't register for that for a few years because I never felt I was good enough or was teaching the way it should be taught because it was just that kind of expectation of what yoga is.
Yeah,
Um,
which is actually, I have to tell you, is different everywhere. I don't know who created this expectation. Because some people say, well, some people say, well, really, I mean, there's something called karma yoga, which is like basically you just teach the community. That's what you were doing. And,
Mm.
it doesn't have to be the classic class. That's kind of like an American thing in
An
a way.
American, yeah, 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 where they have
That's where it comes from. Yeah. So, yeah,
yes,
and we
but
started to realize that maybe something was not quite right or
yeah. Well, it was when I did the yin training. As part of that training, we it was a wonderful training. We learned so much, but there was a whole module on yoga therapy. And I'd read stuff, from Iyengar about how yoga can be used therapeutically, but then I'd look at the images and I'd think, well, how is that supposed to help someone's neck? It didn't make any sense to me. But then when I was reading about this, I was like, the application to like taking those tools and applying them truly in a therapeutic way to support someone through stages of their life, conditions, medical conditions, mental health. Um, and I read that and I was like, that's what I want to do.
Yes, of course.
That's where all of these different dabblings and all of my informal stuff has led me.
Yeah, and what I find most fascinating, of course, is that I know, for example, Light on Yoga by Iyengar, it does include a lot of therapeutic at the end of the manual. It kind of like says, okay, for heart disease, this, for, and then when you as a doctor, you must have seen some of these practices for either heart disease or one of them thyroid problems, other words, the like crunching the neck. Or
Yeah, yeah,
then
yeah.
you, as a doctor, you go,
Mm.
wait a minute. Yeah, the concept is good. The concept of using the tools of yoga is good, but maybe this is not,
Yeah.
obviously. As a doctor, you can see it because you see, when you're a yoga teacher or yoga practitioner, you don't know that your blood pressure rises when you put your head down. You don't know.
Mm.
So if there is a yoga tradition that tells you, do a shoulder stand, and then this is for cardiovascular disease, you as a yoga teacher, you don't know, but you as a doctor, you know that, wait a minute, this is not right for somebody with high blood pressure. Yeah, the blood pressure is going to go up through the roof if you do this.
Mm.
So, yeah, it's
And this was kind of reinforced because I remember saying to someone, I carry stress in my neck and shoulders. And so
yeah,
someone said, I will send you some postures to do to help with that. And what he sent me, I was like, that is not safe. I know I don't have any bony problems, it's all muscular, but if I did have bony problems, no. And he was like, I know all about how to use this to support. And I was like,
all theory. It's all
yeah,
theory. It's all yoga theory. And actually, there's no medical or just simple biology and anatomy and physiology uh, foundation on that.
yeah, yeah. Because because if there is any application of any anatomy or physiology, it's all the subtle aspects which
Mm.
are theoretical, experiential.
Not
I
purely
mean,
theoretical. It's a little bit like castles in the sky and unicorns. I always say,
mm,
I remember, two students in class having a little bit of an argument. One of them saying how Udana Vayu leaves the body through the head, and another one said, no, it's through expression. And they were having a real argument about it. And I said, well, I think we're actually discussing something of the likes of, are unicorns pink or are they blue? Because we cannot know for sure these invisible aspects, and they are based in belief. So yeah, and so therefore is a little bit tricky, but especially when it comes to a human being's health. As if, like, for example, that you had neck problems,
mm, mm,
then to say, oh, I know this thing is good for you. Well, wait, you're a doctor, and you go, wait a minute,
mm.
and right, and it's unfortunate that that is the case, but the idea of yoga therapy in itself is wonderful concept
Yeah.
because yeah, and between you and me, Yasmin, maybe I would like to know your opinion. In the same way as yoga can help with health issues, so can Tai Chi, so can Qigong, so can other maybe practices in South America, in some other movement and traditional and Chinese medicine, for example, acupuncture, the concept of the meridians, right? That can also help and support with health issues. So I always like to keep an open mind in this area to say, okay, it's not only yoga, everybody.
Yes.
We foolish to think that there can only be one system that can help human beings because we have civilizations around the world,
Exactly.
right, that have worked really well for whole civilizations. So yeah, definitely, and for sure. So, but you felt that this was a good marriage, the yoga with the medicine, and you thought this is for me.
Yes, particularly what I learned to appreciate personally is the you don't need the big movements, these big impressive movements. They don't do anything um, internally. It's the little things, it's the attention to detail, it's the sensations, it's being present. And so when I see my patients who are distracted or distressed, it's the little things. And I think I'd been doing stuff with them for years, you know. I'd see someone that's like, I just want to do some exercises in bed. So I'd start giving them the joint freeing series or start. And then yeah, and then I realized, oh, I can go into a little bit more detail about that. And I
Mm.
think it's a beautiful practice to bring into the chaos of a hospital.
Yes, 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 yes. So you qualified as a yoga therapist, actually at our school, but still you were determined. So I think you would have done it anyway. Become a yoga therapist, and what are your biggest takeaways from it? What are your biggest takeaways that you've learned? Because of course you must have gone in with some expectation, and then by the end of it, what is it that you were able to extrapolate and to take out? What,
I
which essential oils did you get out of that you could use in your work?
well, I went in with no expectation. So I'd done this little module and I knew that this is something that would be beneficial, but I didn't know in what shape or form or how that would come through. And I was like, I'm just here for the journey. I looked forward to our modules, our weeks. I looked forward to spending time with everyone else, learning, um, you know, some of the case studies you and the other teachers would talk about. I just I just wanted to be immersed, and there wasn't really any expectation of what I would do with it at the end, other than I knew I wanted to use it in some way.
Yes, I understand that completely. That's exactly how I went into my training. It was like I had no idea. Imagine also, over 20 years ago, what expectations could you have if you were therapy? You
Hmm.
didn't know. And I just thought, okay, I'm just diving in because I think that this is exactly what I want to do. And yes, no expectations. And that helps a lot. Um, so, yeah, so what would you say from yoga therapy that you took out that helps you with your work? You said the little things.
Yeah.
Do you mean that less is more, the more simple movement, simple breath, nothing complicated?
Um,
You mentioned joint freeing series. A lot of people don't know what that is. That comes from uh,
that's part of the Hatha Yoga lineage. So that was the Paramuktasana
the
series.
Pavamuktasana coming from the Bihar school of yoga, actually. So, yes, of course, and Mukunda Styles kind of like development because he was sick as well and he had cancer. He developed the joint freeing series, which is based on the Pavamuktasana series one, the joint freeing series, because Pavamuktasana series two and three is quite advanced, actually.
Yeah.
So, so part one, and so that is something that you use quite a lot. I can imagine the joint movements with the breath, right?
Yes. Joint
Yeah.
movements with the breath, just being really present with someone, even if it's 10 or 15 minutes,
Mm.
just present, no expectations of them, working pain free. That's a huge one, working pain free, because, you know, in mainstream yoga, it's almost the expectation you push through pain, like
Yeah.
to look a certain way. Yeah, keeping it simple. And I think I did you know, the I've always found pranayama difficult to teach other people, although that has changed. Uh, I've been having my pranayama lessons with Caroline.
With Caroline Keeler, yes.
Yeah. Um, but what I love about yoga therapy is it's just working with the natural breath or trying to bring in some functional breathing. But all those pranayama practices, a lot of them are too much, and I think it's nice to recognize that actually these are too strong for um for most for a lot of people who have got medical or mental health
Well,
Well, most people probably.
Most people,
You've got
because
to train.
who doesn't have dysfunctional breathing these days? So,
It's
right,
true.
and
Everyone.
we're all subtling, we're all suffering from subtle hyperventilation. We're all holding our breath, and right, okay. So then to go straight into these pranayama practices, and that's the reason why many people actually feel unwell a lot of the times after coming out of a pranayama practice.
Mm.
So yeah, of course. So you're going to, so what, where are you now at this stage? You also trained as a Yoga Nidra facilitator with Uma Dinsmore-Tully, Yoga Nidra Network. Yes, and I think that that must have been, of course, an extraordinary experience. I know Uma and I go a long way, like I mentioned also in our conversation as well. Wild spirit, definitely for women's health and women's rights and for
Yeah.
everything that represents female, a force of nature. So how do you integrate yoga nidra? Do you still integrate? Can you do yoga nidra? Of course, we're going to learn more about this in yoga nidra for health. Sorry, yoga therapy for healthy aging. But how do you feel about yoga nidra for your older clients, for your older patients?
Mm. So I have done yoga nidra in the hospital,
Yeah.
but but I um but I haven't been there doing it for them. It's been recorded and I've given someone headphones. But
Wow.
I've stayed there in the space to make sure that they're okay. Um, but I have mixed feelings, a little bit of mixed feelings about how suitable it is for certain groups of people, maybe dementia, cognitive impairment. We're asking people to maybe create a visualization and things, and
Can be a
um,
little bit scary. I know.
yeah.
I mean, yeah, due to the family and other events and clients and friends. Yeah, if you're a little bit familiar with Alzheimer's, then you know that maybe it would not be a good idea. Yeah.
Um, and I also think, if you're stuck in hospital and you want to go home and you're feeling lonely and someone is coming around to do something with you, but maybe you've only met them a few times, and then you give them a practice where they have to, maybe it will bring up emotions and they're in a bay.
Yes. Yes.
I'm really picky about using yoga nidra in that sort of setting. One to one,
Yes.
absolutely. I prefer sort of doing the body scan
Yeah.
and then just a little bit of relaxation afterwards rather than a complete yoga nidra.
Very interesting. Very interesting. Absolutely. Absolutely. Again, it's another practice that everyone said, oh, yoga nidra for everything. It's like, no,
Mm.
not
Mm.
yoga nidra for everything and not for everybody. So where are you at right now? What are your plans? Just wrapping up a little bit.
Yeah, yeah, yeah.
What is it that you're looking forward to? What is your vision of what you would like to do? Because I really admire this perspective that you have regarding elderly care, older person's medicine, and integrate. Are you still as disillusioned with the medical system, or are you changing a little bit, or what's going on right now in Yasmin's head and heart?
Um, so I still get my moments of disillusionment, but I think like I know that's how I feel now, so it's less upsetting, as it were.
Mm.
And I know that I'm doing something that makes me feel I'm able to give more to other people. So that's a really lovely balance. In the hospital, I'm just continuing to see people on wards and offer some sessions in the bays. I'm doing teaching. Yeah. So I've done some teaching in the hospital, but also with yourself.
Oh yes, with us, of course.
Yeah. Yeah.
Teaching with us. Yeah.
Teaching with you. And I did a little bit, so we talked about the mind-body interventions, how they can all help. So I've done some teaching within my hospital about that. And and actually it was really warmly received. A lot of people realised that we need to change the way we see health
Yes.
in this modern period. It's not just a case of giving someone a tablet.
Yeah. Yes, it's not the case of pill popping and okay, here we go, just this but the truth is that medical professionals don't have the time to do something else. So they're running around like crazy and they have no time, and also no time for themselves. So yoga therapy can help and support medical professionals.
Yeah.
And also that there's enough trained yoga therapists, maybe, or such as you, that are doctors that are trained as well to educate, to offer it to the patients, maybe specific groups of patients, maybe specific individuals that may benefit from it.
Yes.
And yes, so I really think that you are one of the pioneers that are introducing this kind of movement from the inside, like
Very,
inside.
very.
I think there's a movie called The Inside Man. I think it's The Inside Woman. Inside Woman, in there.
But it's a teeny tiny drop that I'm introducing. It's not even a ripple yet.
Yeah. No, well, I believe that ripples begin with a tiny, tiny. So, yeah, but that's the beginning, of course. And like you, let's not forget, because we have this collective kind of way of thinking. Yes, they wonder, oh, I'm doing this, and then there's somebody else doing it in Australia, somebody else doing it in the US, because I know a lot of people contact us. A lot of people contact me and they say, Montserrat, you're doing this, I'm doing this over here. And I go, oh, wow, how is it possible that other people are doing the same? And we've never spoken, because there's this collective consciousness. Nowadays, everything is on Google, is in the cloud, is in the air. So what you're doing it here in your small little, drop in the ocean. But in that ocean, there's also others doing similar work and starting very slowly.
My grand plan, were it to ever happen, would be to be able to run a clinic where I see people that are maybe falling, have early cognitive impairment, where we do a medical review, and then I can do some sessions of yoga therapy, as well as fiddling with the medications or whatever.
Yes.
And get
the doctor says fiddling with the medication. If I was to say that, kill me, but you can say it. Yes, managing the medication and then, combining the medical care with some adapted yoga therapy practices. You can never do a blanket protocol.
No.
Conditions, different individuals, different traumas, different, my God, it's so varied. And that would be a fantastic dream. But I mean, why not? It's called time travel. So you do time traveling, going ahead in front of you and saying, okay, that is what, remember when we spoke about the manifestations?
Manifestation.
I didn't know it was called manifestation. It was like me being totally, but it seems to exist, this thing. So
it's a big thing.
It's a big thing. So doing this time traveling and then moving forward, and that's the only way, really. And we're already speaking about this, and more it will be more exposed. More people will be inspired by your grand dream. And it may seem something that, oh my God, this is like nothing. But believe me, I know from experience, from 20 years ago, when I felt that I was the only yoga therapist in the planet. And now, it's really growing, and this could be the same, and it would be, I'm sure it's going to be, because it needs to be. There's a need for it. So, wonderful, Yasmin. Yes, really good. So, let's hope, and it would be great that there could be one day this clinic. And in the meantime, you are teaching. You're going to be our leading teacher in yoga therapy for healthy aging, and we'll do a little talk about that also, maybe that kind of the week before, 2 weeks before the course takes place. And we keep on rocking, keep on going, Yasmin. Yeah, but at least we're not working at the hospital, so you'll be able to take a little rest. Yes.
Oh, thank you, Mom.
Thank you, Yasmin. Thank you.